to say we're on Senate time means it would be 20 after 3, but so I can say I'm a half a Senate time, right, Glenn? Yeah, he said amen to that. So call to order Wednesday, March 12th, Minnesota Senate Human Services Committee. We have a bunch of stuff, so if we could really focus on, what we have, the matter at hand, it'd be great. Ms. Bailey is going to come in. We had this committee, we were talking about, presentations, discussions, what ifs, what if this, we're on a lot of what ifs, right? Which leads me to really have that conversation. We know what the next 2 years, but there's a lot of probablys. We don't know what the 4 years after that. We don't know what's going to happen. So I just think all of us need to just have our ears open and really listen to the what ifs that Ms. Bailey is hearing from a financial perspective only. Does that make sense? I mean, is that what we all talked about? Isn't that everybody? Okay. So thank you, Ms. Bailey, for coming down, Budget Director for DHS. And then we're going to go into the Waiver Reimagine requirements modification. That's a bill. We've been part of that, this group. Then also, we're going to go into Senate File 2347, which is a peer recovery outreach. Then Senators Maye Quade and Rasmusson talking about senior nutrition programs, and then the supported decision-making program. So I think, am I forgetting anything, Jordan? I think we're good. All right. So with that, Ms. Bailey, please. Talk to us. A lot of the what ifs and probables out there, and we just want to know, in your perspective as somebody, because, we look at our budget, right? We make up human services 25.7% of the full budget. Yet, my calculations show that, current proposals out there, they want to take 65% of that outreach. But I don't want to focus on that, even though I think it's not fair. It's absolutely not equitable. And it doesn't talk about the system stuff, but really, in your fiscal financial head, I think this committee has asked you to come and just give us, what's going on. So thank you very much for coming to that. Did I get that right?
Chair Hoffman, Senators, I actually thought the question was a different question, Senator Rasmusson, so I'd be happy to talk about that. But
Yeah. No, go ahead. Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Ms. Bailey. And I know one of the questions that we just wanted some more information on was some more context on some of the federal payment issues that we saw with the budget forecast in terms of the money that the state of Minnesota will have to repay the federal government for the 7 tribal SUD providers. And I guess some of the questions, Mr. Chair, that I had on it were, it'd be helpful to know kind of what exactly was the error that led to that, how that was discovered, and then just understanding too, is it, would it have been avoidable, and kind of how are we on that path to minimizing that cost that the state taxpayers will have? So those are just a couple of my questions, and I appreciate Ms. Bailey coming and kind of just helping give some more information to the committee members on that topic.
And I'm sorry if I was assuming we were also going to have a discussion about what if, the what if factor. What if all of a sudden we capitated block grants on a federal, what if, and that's what, not that you can predict a ball, but what does that mean for us as a committee? And if you're not prepared to do that conversation on the what ifs, just because I think we should all be prepared to have that conversation, especially when, the pork chop's sitting around our neck and the $1.5 billion, which, by the way, did I tell you, it's 65% of the piece. So 25 equals 65. The math ain't mathing for me. So with that, Ms. Bailey, thank you, Senator Rasmusson, for pulling me back in the right course of action. So how's that?
Well, Chair Hoffman, I could do both. Which would you like me to address first?
I think go with the good senator from the Fergus Falls area.
Okay. Well, thank you. Senator Rasmusson, to answer your question, yes, in December of 2024, our policy staff in the behavioral health area of our administration noticed or realized that in our system, we were coding these specific residential SUD providers as not an IMD, or an Institute for Mental Disease. In our system, we need to code those appropriately in order to determine what the correct state or federal share is, because under the federal requirements, IMDs are not eligible for a federal share. So these services were paid as intended. The providers provided them as intended. It wasn't a payment error to the provider or any fraudulent activity. It was really on the back end. Does it come from the state account or does it come from the federal account? The services have been provided at 7 different locations and since back to 2015. And so what you'll see in the forecast is an impact of about $113 million for that back pay that we paid out of the wrong account, the federal account, instead of the state account. We would have had to pay via state funds all along. So the amount is big at this point in time, but it would have been paid each year at, up until this point in time. So it's more of a timing issue. However, besides the fact that in 2020, I believe the legislature authorized a new waiver that where the feds have allowed us to pull down a federal match for these IMD services. And in 2021, my understanding is residential SUD providers the legislature passed a law that said they have to join the waiver. And joining the waiver means that they have to go up to a level of standards according to these national standards, and they would have to elect to join the waiver. And that requirement for all SUD residential providers was for fiscal year 2024. Tribal entities were excluded from that requirement due to their sovereignty. And so that's kind of the rub, is that they could have joined the waiver, as of those dates if they elected to, but they weren't required under state law. So we are working with them to, if they choose to join the waiver, we would be able to pull down the federal match for those services, but absent that, we'll have to pay out of the state funding.
Thank you, Ms. Bailey. And I guess, is there, so like going back to the 2015, I guess, do you know why these 7 entities kind of weren't put on a waiver, or why the federal match drawdown wasn't pursued with those providers? Does that make sense, or I can try to rephrase the question?
Try to rephrase the question.
Yeah, so I guess the core question I have is, going back could have this been avoided if we would have basically had been aware of the situation and sought a waiver for these 7 providers, and basically, had this $150 million, paid for by the federal government if we would have had that kind of different waiver strategy all along. And that I guess what I'm trying to understand, if that makes sense.
Senator Rasmusson, so the waiver is really for any SUD providers, so they could have elected to apply for it. Had we noticed the error, it was an error on DHS's side. We should have been booking from the right accounts all along, and so we acknowledge that we made the error. Had we acknowledged it earlier or found it earlier, yes, once the legislature authorized that ability for the 1115 where we could pull down the federal match, and we could have been working with these tribal providers to see it, to be more actively working with them to see if they would elect to join the waiver. But they aren't under law right now required to, like the other providers.
Senator Recchi.
Thank you, Mr. Chair, and got a couple questions for you along those lines, because we had a chance to have this conversation this morning. I guess I'll start with what we're currently on, and this morning I guess I asked you to put that to hopefully the top of your agenda to work this out to make sure that they sign the waiver or do whatever we need to do there. But I'll ask it another way. Would it be better, would the department rather have us put a bill together that says that they need to be part of this? Because, I mean, at this point, we're sending taxpayer money out for something that we shouldn't be paying for. So what's better, to just let you guys negotiate, or do we put something on paper to put it into the bill form?
Ms. Bailey.
Chair, Senator Aki, I think if the legislature were interested in doing that, engaging with the tribal nations would probably be the best they would probably be the ones to ask versus like the Department of Human Services opinion on it. Not to skirt the question, but I do think since they're sovereign nations, they might have some thoughts on whether that would be an effective thing to do in law, or whether, how interested they are in joining the waiver absent anything in law. So I'd hate to speak for them in this case, just given that they're sovereign nations.
Senator Radke, follow up.
Yep, thank you, Mr. Chair. I'll follow up with you, and we'll kind of get some guidance on this and see where it needs to go in the next few days or whatever. As we talk about, this was a waiver that we just didn't get signatures and stuff on. Do we have anything else out there that we got people to have a choice whether they sign up for a waiver or not? And if they don't, we're paying the bill that would know offhand at this point?
Ms. Bailey?
Chair, Senator Radke, I don't know any offhand, but I can certainly, the team can take that question and ask our folks.
Okay,
Senator
yeah, because
Radke.
it comes up every now and then, and it's like, well, do we have others laying out there? But that's all for right now. Thank you, Mr. Chair. Thank you, Ms. Bailey.
Thank you, Senator Radke. And Ms. Bailey, I just want to make sure that I'm understanding the total impact of this. So the one-time cost in fiscal year 2025, I have down as $113 million. And then for the 24-25 biennium, I think is it $12 million, then 26-27, $25 million, and then 28-29, $6 million. Does that match what you have?
Let me check. Chair Rasmusson, I have a total of $125 million in this current biennium. That includes the $113 million from the back pay, and then moving forward, assuming that we are paying the state share. Going into the next biennium, we do assume in the current forecast that those tribal nations will choose to opt into the waiver. And so we have a cost of $19.3 million for the total for that biennium as a result. And then by the tails, we aren't assuming a state cost for this because we are assuming that they will transition. It is a forecast where we're making assumptions based on what we think will occur. And so that isn't a sure thing, but that's kind of what our assumption is, that they will transition to the waiver.
Yeah. Thank you. Senator Hoffman?
Thank you, Mr. Chair. Thank you. And so that's a lot of some of that we get the federal match on top of that, so that this is helpful. I'm wondering, Mr. Chair, as we look at forecasting, is there anything that we should be aware of that's come across your plate that we should just be thinking about? I'm not trying to project anything, but there's a lot of conversations out there. And then I have a couple of follow-up questions about something we did last year. Since Ms. Bailey is here with us, it's a fiscal question, so thank you.
Thank you.
Chair Hoffman,
Bailey?
or Chair Rasmussen, Senator Hoffman, are you looking for just some high levels we found in the February forecast? Yep, okay, yeah, sure.
Mr. Chair, I think
Senator
that's
Hoffman.
what this committee was talking about, Mr. Chair, and Ms. Bailey, for the last few weeks was just like, yeah, what does that look like? And then that should get us thinking about, since everybody else is making decisions 4 years down the road saying, well, probable 5 times, she said probably in our meeting, 5 times. So, I just wanted to get that point out there. So thank you.
Ms. Bailey.
Chair Rasmussen, Senator Hoffman. Sure. So we have some key drivers that we're seeing in the February forecast. As a full picture, we're projecting about $290 million more spending in this current biennium that ends in June. About $355 million in the next biennium, so 1.9% increase, and $355 million in the planning years, or 1.6% increase. We're also seeing an increase in the Healthcare Access Fund, so in next biennium, 3.3% increase, and in the tails, 3.9% increase. Those numbers, looking at like the biggest drivers, they're really centered around continued growth in the disability waivers, a higher level of acuity in MA basic care. We had to increase our managed care payments or managed care contracts according to increases in weight loss drugs within the MA and Minnesota care programs.
Senator
Okay.
Hoffman.
So just repeat that statement. Managed weight loss drugs. So it's not old people and people with disabilities, like that was in the first sentence of when the MMB commissioner made the comment. It sounds to me like there's some other factors that are driving this ship, not just those. I just am asking, that's all.
Ms. Bailey.
Chair Rasmusson, Senator Hoffman, yes, there's multiple factors that are increasing costs in the forecast. Okay, and the fourth thing is the Behavioral Health Fund. Going into a little bit deeper depth of that, when it comes to the disability waivers, we're seeing that the disability waiver inflationary adjustments set to occur in 2026 and 2028 will be higher than previously projected by about 1%. The average payment data, meaning the number of claims and the total cost for payments, is also increasing compared to the November forecast. It's about 1.5% higher. So that's in the updated numbers. We're also seeing higher recipient growth on the DD waiver, concentrated in kids and youth. That's increasing the recipient base by about 1%. For all of those items, that increases the disability waiver forecast by $35 million in this biennium, 160 in the second, and 141 in the tails. We're also seeing nursing home payments go up compared to the previous forecast. We're projecting average payment operating rate increases that are higher than the previous forecast, as well as increased paid days projections. You'll see in our forecast as well a slower take-up of CFSS, given that we talked about this in this committee on how there's a slower than we anticipated transition over to CFSS from PCA. And that is notable in the forecast because once somebody has transitioned to CFSS, we get an enhanced federal match of 6%. We're also seeing a higher take-up of state-funded parent and spousal caregiver option. Remember, the legislature authorized a state-only funded option until CFSS was up and running, and we're seeing a higher take-up of that option under the PCA program. That's a one-time cost because once we transition to CFSS, it will be covered via federal funding. On the basic care program, we're seeing higher than expected fee-for-service payments and higher level of acuity in managed care. So this is a result of after the pandemic when we did all the unwinding work, and now we have a population that has gone through the re-enrollment process. That's a smaller population than who we served during the pandemic, and the acuity levels of that smaller population are higher comparatively because it's a more condensed population. As I said, the weight loss drugs, we're finding that we had to update our managed care contracts as a result of increased claims that are being paid for weight loss drugs. This is not a new thing, not just Minnesota. A lot of states are experiencing this, and a lot of entities paying for healthcare coverage are experiencing this. And so you'll see in the forecast about 12 million in this biennium, 78 in the second, and 88 in the planning years as a result of these increases. And then we do have some increases in Minnesota Care as a result of increased enrollment and those weight loss drugs. So that's a summary. What we don't have in the forecast is any impact of potential changes in Congress. So for example, the $880 billion House budget resolution, because that's not law, we don't anticipate that in the current forecast, so we'll have to keep that in mind as we go through legislative session as the federal stuff progresses and what that means for Minnesota. We have done math on that. If it were proportional across all states, that would be about $1.4 to $1.6 billion loss to Minnesota's federal funding starting in '27 and increasing over time. But that, of course, would depend on the mechanism. So it very well may not be proportional. It may be something that actually impacts us more than other states or less. It just depends on the mechanism. So with that, I think I'll stop.
Thank you, Ms. Bailey. I appreciate the information and kind of talking about some of the key changes that we saw in last week's forecast. So, any member?
I had two questions.
Senator Hoffman.
And then Senator Gruenhagen's got two questions too. So thank you, Mr. Chair. So as long as you're up there, there was last year, you were part of this meeting and we asked for the incentives. This committee asked for the incentives for care out of, the same, out of care. Remember that $1 million? And it was just like, can you give us an update on where we're at with that so far? I have not seen any reports or anything, but do you happen to know where we're at in the process of that money getting to the staff?
Ms. Bailey.
Chair Rasmusson, Senator Hoffman, are you talking about the Workforce Incentive Fund? Okay.
Yeah, Mr. Chair?
Yes,
Yeah, remember when we had a meeting and it was about the Carlton?
CARE.
Yeah, CARE Carlton. I'm sorry, I should have been more.
No, you did say that.
Yeah, I did.
Ms.
That's
Bailey.
okay. You weren't
Okay,
listening.
Chair Rasmusson, Senator Hoffman. My last update was maybe a month ago, so I may be behind the times. My understanding is that we had agreement on how those funds would be spent with the workers, and that we were in process of getting the money out the door. Now, that was a month ago, so I would need to actually
Thank you.
confirm.
So, Mr. Chair.
Thank you, Ms. Bailey. Senator Hoffman.
Thank you, Mr. Chair. Yeah, that'd be great if you could give an update, and I appreciate that, and that's where I thought it would be. So also, Mr. Chair, if I can ask one more, and then I'll be
Senator
done.
Hoffman.
The LPNs were told that out of our committee, the LPNs were told they were going to get a hiring bonus. I believe it was $10,000 or something, $5,000 or $10,000 hiring bonus, right? And that's what if they started once they were off probation. I'm hearing that somebody within the state is saying that that's not available or not allowable. Has that money been expended? Is that money still sitting there? Can you give us, and if you can't answer that question, I absolutely understand that, because it's more of a, but it's a dollar figure that I remember LPNs, once they get off probation, to try to attract them to work in our direct care and treatment programs, Mr. Chair, was to, give them that $10,000 bonus. Where are we at with that?
Ms. Bailey.
Chair Rasmusson, Senator Hoffman, I'll check for you and get back to you.
Thank you.
Thank you. Mr. Chair, if you're going to do that, maybe just send the whole committee just an email as an update. That would be great. So thank you, Mr. Chair. I'm good.
Thank you, Senator Hoffman. We're going to go, and Ms. Bailey, first off, thanks for coming here, and I don't want to make this kind of DHS open mic night in terms of just what we're talking about, but so Senator Gruenhagen, if you have a question on the federal payments, please go ahead. Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, just a quick question on the weight loss drugs. This is a rather recent phenomenon. Was this a federal or state requirement that was covered by medical
Ms.
assistance?
Bailey.
Chair Rasmusson, Senator Gruenhagen, I can double check, but my understanding is that the legislature added it in 2022, is my understanding.
Our state legislature?
Yeah, I think so. And at that time, we had only 2 drugs available. Once it's added to a benefit, though, all the drugs that are approved by the FDA, my understanding, are available. And so we've had many more drugs come on the market since then. So it's a much different kind of fiscal picture. Maybe great for people as far as obviously getting access to needed care, and there may be dynamic scoring, shall I say, outside of, in other places of MA. But what we're picking up in the forecast is the actual cost of those drugs. So yes, I think it was a state added benefit.
Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, so what were the figures you gave for the next few years in terms of cost?
And Senator Gruenhagen, are you talking about the increase for the GLP-1
Right.
drugs? Ms.
Yep.
Bailey? Could you repeat those
Yes.
numbers again? Thank you.
Chair Rasmusson, Senator Gruenhagen, $11.7 million in this biennium, $78.7 in the next biennium, and $87.6 million in the planning years. Those are the increases compared to the November forecast. So they're not the total claims that we pay, but the increases to our
These are going
capitation
to be the
payments.
increases.
Yeah.
Thank you, Ms. Bailey.
Okay.
All right, thank you. Thank you, Senator Gruenhagen. If we're all, thank you, Ms. Bailey. I think that's all we have.
Great.
So, thank you. So, next up, we have Senator Hoffman with two different bills. We'll be starting off with Senate File 2215. And Senator Hoffman, to your bill.
Thank you, Mr. Chair and members. And this is one of the conversations we've been having for a few years. Oh, go ahead, Mr. Chair.
Senator Hoffman.
I thought, no, we're good. Thank you, Mr. Chair and members. This is a Waiver Reimagine conversation we've been having since the good senator from Anoka started having reimagines about waiver, and this was a few years ago. Senator, you remember that conversation. But Senate File 2215 is a Waiver Reimagine legislative task force on Waiver Reimagine. Lots of people have been involved with this bill, and it's really been kind of like the, it echoes where we as a group have been talking. But I want to bring up Kathy Jo Ware, Tricia Brisbane, Lisa Vala, Katrine Bachmeyer, Debbie Harris, Maren Christensen, and Jean Bender. And I don't know we can get you how you guys are going to do that or come on up, but you can start coming up to do that. But I can just give you an overview. This really, Senate File 2215, strengthens the oversight, transparency in the Waiver Reimagine project, ensuring that those affected of the policy changes are actually have a seat at the table, right? It requires the department to collaborate with the Waiver Reimagine Advisory Committee and submit a full report. If you remember 2 years ago, the now Assistant Commissioner, the then was a Director, actually was Assistant Commissioner, is still Assistant Commissioner, heard the parents talking about why they didn't feel they were part of this conversation, and this really has led to folks meeting, and there was some inconsistencies on how the facilitators of the process who were hired by the department did their work, and those stories absolutely were not what we needed to hear from being collaborative or transparent. And so this bill really establishes that task force on Waiver Reimagine that oversees the process, gathers the public input, and submits the final report to us, Mr. Chair, January of 2027. DHS then is also, it's prohibited from submitting the waiver plan to the federal government without the task force approval, ensuring accountability. We all talked about this last year, and I think the language in here, Senator, is where we're at with that. The advocates have raised concerns that the current system may unintentionally push individuals into congregate care, which those of you that get emails probably see. There's a certain nurse from a certain county south of us, maybe Dakota County, who is also a parent who's very knowledgeable in this avenue. You might hear from her today, actually you will. That really looks at reflects the actual needs, right? This bill is about collaboration. This is what we're about, collaboration and common sense. Jim Ramstad taught us that, and I'm saying that we need to really, decisions on disability services should include the voices of those directly impacted. So, Mr. Chair, with that, Kathy Jo, you want to come up first? I mean, what do you got? Tricia Brisbane?
Thank you, Senator Hoffman. Yeah, first up we have Kathy Jo Ware, and then next we have Tricia Brisbane.
Yep.
Then after that, Lisa Vala.
Yep.
So if you can make your way to the table, we'd be happy to hear your testimony.
Tricia, Charlie, come on up. Lisa, if you want to start, come on up too. Or Kathy, if you're coming up, we can start filling it up. So.
Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chair. I am Tricia Brisbane, and this is Charlie Brisbane, my son. Mr. Chair and members of the committee, thank you so much for the opportunity to speak today on behalf of individuals with disabilities and their families. As requested by Senator Hoffman last year, I brought Charlie with me to meet all of you today. After speaking before you last March, I had truly hoped we wouldn't need to return. At that meeting, Natasha Mers and the Department of Human Services were strongly encouraged to collaborate with stakeholders. However, I'm here to inform you today that no meaningful efforts have been made by DHS in this regard. I'm the parent of a child with disabilities, and I am a member of the Waiver Reimagine Advisory Committee. I've worked with children and youth with disabilities and their families for over 14 years, helping them navigate complex systems of care, including Medicaid waivers. Home and community-based services waivers were designed to allow individuals with disabilities to remain in their homes and in their communities, right? These waivers have been instrumental in the movement to deinstitutionalize our citizens. If we proceed with Waiver Reimagine as proposed by DHS, Minnesota could lead a troubling new path to reinstitutionalize its citizens with disabilities. Minnesotans like Charlie deserve to live a life of choice in their homes and in their communities, not in institutional settings. The disability community, along with the Senate committee and the RAC, has been advocating for DHS to stop creating policies and programs for us through a one-sided process. We have abundant data and research showing that collaboration with stakeholders at the systems level saves money and greatly improves outcomes. I have personally spoken with DHS staff individually during RAC meetings and through emails offering to help DHS understand how to meaningfully engage with communities in a collaborative manner, specifically regarding Waiver Reimagine. Best practices for this process exist, and I've shared specific resources with DHS multiple times. DHS should want this authentic partnership, but clearly they do not. I believe all of you would be deeply concerned by how RAC members have been treated during these meetings, facing condescension and belittlement. In fact, certain RAC members' requests for accessible accommodations have been repeatedly ignored and disregarded. It's become painfully clear that we are treated as a mere checkbox and are not regarded as experts on these matters. We've demanded that DHS partner with stakeholders, people with disabilities and their families to make crucial decisions regarding Waiver Reimagine, but they've refused. Therefore, we ask you to hold DHS accountable, and I won't read it. Senator Hoffman just did that for us in Bill 2215. Last year, DHS received strong encouragement during the March Senate committee meeting. However, it feels as if they walked away without taking that seriously. Because we are here again with no significant changes, and RAC members can attest to that. Many of my fellow RAC members and stakeholders wanted to be here today. The main reason they are not is this is very traumatic to address for stakeholders. This Waiver Reimagine is going to impact our lives very significantly. My colleagues will provide expert testimony today, underscoring the importance of waivers and expressing how much we value living in a state that treats citizens with disabilities with dignity by supporting these home and community-based service waivers. They will share specific details about how vital these waivers and the related services are to us, and they'll reference the many ways in which the proposed Waiver Reimagine plan will take all of this away. Historically, conditions in institutions and facilities were characterized by poor care and education, segregation, isolation, overcrowding, underfunding, and neglect. We now face a staffing shortage. Can you imagine sending your vulnerable family member to a facility? I cannot, and I will not. Medicaid and waivers in Minnesota are not perfect, but we must continue to improve them. Waiver Reimagine must be reworked to prevent forced institutionalization and ensure equity, independence, and dignity for people with disabilities. For Charlie. Thank you so much for your time.
Thank you.
Thank you very much. Senator Hoffman, before we forget, I have noted here that you have a A1 amendment. Would you like to move that for adoption as an author's amendment?
I do. Thank you, Mr. Chair. I move the A1 amendment.
Senator Hoffman moves the A1 amendment as an author's amendment. All those in favor of adopting, say aye.
Aye.
All those opposed, say nay. The A1 is adopted.
Thank you, Mr. Chair.
Next, we have another testifier here at the desk. Would you please introduce yourself for the record and please proceed with your testimony? Welcome.
I will. Mr. Chair and members of the committee, my name is Lisa Vala. This is my daughter, Amanda. She is a recipient of a traditional developmental disability waiver who lives in her own home and will be severely and adversely affected by Waiver Reimagine. The budget inequities inherent in DHS's Waiver Reimagine will cut her current waiver budget in half. Waiver Reimagine bases budgets on where a person lives, providing generous budgets to those living in residential corporate care, and about half the budget amount to people living in their own homes. Here are the numbers. Today, Amanda's residential supports cost $190 per day. If she does not get the budget she needs to stay in her own home, she will be forced to move into a community residential setting, a group home. That will cost $335 a day. This is a 50% increase to the state for her care, where she would be forced to live in a setting not of her choosing, and that violates her rights. So in summary, supporting people to live in their own homes is supporting choice and is more cost-effective than providing care in residential settings. Waiver Reimagine budgets should not be based on where a person lives. I also want to make you aware of the major rulings and policies that Waiver Reimagine clearly violates. At the federal level, the Olmstead Promise, the 1999 Supreme Court case that establishes a person's right to needed supports to live in the community. At the state level, Minnesota's Independent Living First policy, which is in statute, and is based on the idea that a person should be able to live independently in a non-provider controlled setting. In summary, because Waiver Reimagine has an institutional bias, it violates both of these policies. Please, we have to get this right for the 70,000 Minnesotans who rely on waivered services. Senate File 2215 requires DHS to base waiver budgets on need and not on where a person lives. And it requires DHS to seek legislative approval before submitting their plan to CMS. In addition, we are seeking a legislative task force to study the problems, and this task force will provide a roadmap for waivers that will serve us well into the future. Please support Senate File 2215. Thank you for listening to my testimony.
Thank you. And I think we have Ms. Bachmeyer.
Kathy Ware.
Kathy, welcome to the committee. Please introduce yourself and proceed with your testimony.
Thank you. Chair Rasmusson and members of the committee, thank you for the opportunity to testify for you today about Waiver Reimagine. My name is Kathy Ware. I'm a registered nurse, public health nurse, and I'm a certified MnChoices assessor. This is Kylan. He's 30 years old and he lives at home with me. He always has, and hopefully he always will. Kylan has a total deletion of the MEF2C gene that results in profound physical, medical, and cognitive disabilities. Kylan uses the CAC waiver, or Community Alternative Care Waiver, with CDCS, which is the self-directed option for his care at home. This is my Waiver Reimagine folder, everyone, and this has been thinned down, by the way, because it got too big. I testified in 2021, and I presented you with this lovely image of what Waiver Reimagine will do to my son and to my family, and that is DHS staff hauling him away to a residential facility. I testified again in 2024. I've sent numerous emails to everybody that I can think of with influence and power to help us. Now it's 2025, and I am here to tell you that the Department of Human Services is not hearing us, and the Department of Human Services is not seeing us. I've been squawking loudly for over 4 years about home care nursing and self-directing all or a portion of the home care nursing allocation. as it is currently allowed right now under CAC CDCS, and as it was previously allowed under CSG before they changed it to CFSS. It's confusing, right? How can Kylan and I feel heard and seen, you might ask? I need our identified problems created with Waiver Reimagine to be addressed and fixed, and then I need this repair by DHS communicated to me. Being seen and heard isn't about complaining for me. It is about fixing the problems that are created with Waiver Reimagine by DHS. These self-directed budget ranges are huge for our community, right? This hasn't been updated since 2021, yet DHS will say to all of us, oh, those are old, we're not using those anymore, yet we're in 2025 and we've not seen anything different so far. I would like to request today, in all transparency and truth and openness, that we get to see these budgets that are going to affect our lives. Today I want to tell you that Kylan living at home with me saves your taxpayers in this state of Minnesota over $300,000 a year. If you force me to put him into congregate care institutional facility, you will cost taxpayers that much annually for his care, over what he is getting today. And he's covered on my private health care insurance as primary payer, not even medical assistance. So keep that in mind. If we're talking about taxes, I help you. You want me. You want him staying with me. Why should Kylan's life and his staffing be uprooted due to a change in more costly Waiver Reimagine? This is my Heather. Heather has been working with Kylan for over 8 years. She is my right-hand girl. We adore her. She adores us, and she's been with us through sick times, hard times, and all the times. And if Waiver Reimagine is implemented, we will have to give her up. We shouldn't have to do that. And we should be allowed to keep Kylan at home and to save taxpayers' money at the same time. And I respectfully and humbly request that you pass this bill to help us hold DHS accountable to that very thing. Thank you.
Thank you. We have another testifier. Welcome to the committee. Please introduce yourself and proceed with your testimony. I'll just also say on deck, I have Debbie Harris is next, so if you could make your way to the table, that'd be great.
Thank you, Chair Hoffman, Lead Abler, and members of the committee. Thank you for this opportunity. I'm Reverend Katrine Bachmeyer. I help administer the Min Choices Assessment Support Group, where we hear directly from families navigating Minnesota's complex disability services system. This is my daughter, Nyla. And every day I hear from participants and families fighting to remain at home, struggling with sudden service cuts and losing vital life-sustaining supports. And this is Grace. I brought her case to you a year ago. She was approved for nursing CAC waiver care in Hennepin County, but St. Louis County denied those same supports, despite no medical change. Today, she is on a ventilator fighting for her life as a direct result of our failed services systems. And Grace's case is not unique. Thousands face similar failures due to Minnesota's broken Min Choices assessment and disability services system. Last March, DHS testimony assured this committee that there would be no reductions in budgets for Min Choices 2.0 and that a special team would address reported budgets, cuts, and terminations. Those promises remain unfulfilled. Bill SF 2215 recognizes that Min Choices is failing with life-threatening consequences. Additionally, as evidence has been submitted today, it shows that DHS is implementing Waiver Reimagine under different names through CDCS unbundling, form changes, and CSP form changes, also through bulletins being posted on their website, circumventing the legislative pause that you intended. SF 2215 is essential because Minnesota implements sweeping changes and then leaves vulnerable participants scrambling to survive the fallout. Minnesota's proposed disability service changes incentivize institutions, leaving Minnesota vulnerable to costly federal investigations and federal lawsuits. We need to recognize that CMS approval does not equal Olmstead compliance. What makes SF 2215 critical is its enforcement power. DHS routinely ignores oversight because our directives lack teeth. This task force would break that pattern, ensuring real accountability and stopping harmful changes before they take effect. I urge you to support SF 2215 to protect lives, uphold Olmstead obligations, and bring accountability to this broken system. And before I close, I'd just like to take a moment of silence for Grace and her recovery. Thank you.
Thank you. Ms. Harris, welcome to the committee. Please introduce yourself for the record and proceed with your testimony. And then we also have Maren Christensen Hoffer up next.
Thank you, Mr. Chair. Thank you for having us and for taking the time to listen to our story. I'm Debbie Harris. I'm from Eagan, and this is my son, our son, Joshua. So today, at the risk of sensationalizing the subject, I believe it's important enough to share a very critical experience that happened in our lives with you today. Not quite 2 years ago, Joshua was rushed by LifeLink to Regions Hospital. He was assessed by his home care nurse emergently and subsequently diagnosed with pneumonia, pancreatitis, sepsis, small bowel obstruction, ischemic bowel, and pleural effusion. It wasn't compatible with life. My worst nightmare, which is, I think, every mom's worst nightmare in our situation, was that I wasn't able to be with him. I'd had spine surgery, and I had a very virulent infection in my spine and was in another hospital across town and could not be released. So I wasn't there for the first time in Josh's entire life. I've always been at the hospital with him every time he'd been in the hospital. So I was inpatient miles away, and it was Mother's Day. Josh's complex care physician at Gillette warned me to prepare for the inevitable. His palliative care physician told me to use my faith and to pray. So I chose the latter. But here's another miracle, besides the fact that Josh is right here with us. Josh is on the CAC waiver. Yes, you are. Thank you. Josh is on the CAC waiver, and he uses CDCS. He has nursing care through my husband's military insurance. My husband was an officer in the Marine Corps. He's retired. He was there for 34 years. He'd been in every war from Vietnam through 2 tours in Iraq. I fought for 2.5 years to make the Marine Corps pay for Josh's nursing care. They saved the state of Minnesota hundreds of thousands of dollars per year. But because of the non-competitive wages that nurses are paid through home care nursing that are not competitive with the market, it's not financially sustainable for the home care nurses working in our home. The benefits that they offered are only catastrophic benefits, and they're prohibitively expensive. So we've designed a package for our nurses, and this is Nurse Mary over here. She's been with Joshua going on her 10th year now. We have another nurse, Nurse Ben, who's been with us 10 years. Prior to that, we had Nurse Opal, who retired at 80 years old, who'd been with us 15 years. And prior to that, another Marine, Nurse Shirley, who'd been with us 18 years. We use the waiver to retain qualified, consistent staff for Josh's care, and to fill in the hours where we don't have nurses, we use direct support professionals, which is our family, people who love and care for Josh. And so that is the other miracle. When Joshua was in the hospital and I couldn't be there with him because of that infection, even though I told the nurse that I wanted all the tubes taken out of me and I was going to take an Uber over to Regents, they wouldn't let me do that. The nursing staff and his direct support workers, they were there for 5 weeks, every single hour, 24 hours a day. Of course, there's no pay. They used all of the little PTO that they had. 24 hours they were there watching over Josh for the entire time. So Josh was never alone for 1 hour. That's dedication, and that's the other miracle. Well, Josh, so that's the extraordinary dedication and the blessing that you get when you have continuity of care, when you have safe care, when you can provide for consistent staff with the package that we put together through using CDCS by providing retention bonuses for nursing and staff. The concerns that I have with the Waiver Reimagine is this. There's no mechanism for self-direction or flexibility that is provided with CDCS for persons with disabilities and medical complexity, like Joshua in the new design. Because of the antiquated nursing model being relied upon in the new design for people like Joshua and the extreme reduction in self-directed budgets for people with the highest medical needs, we're ensuring institution for people like Joshua. It's a dereliction of duty. It's a lack of due diligence in this critical time of nursing scarcity. We've done this before. Josh is 32 years old, though he looks very young, doesn't he? Dependency on the agency infrastructure sets us back 20 years. Even with proposed rate increases, the nursing agencies use what they call, and this is what they've told me, bread and butter cases for complex people like Joshua to mitigate the losses in profit margin from the other medical assistance cases that they have on board. They do not pass the increases on to acquire, retain, or incentivize nursing staff. They cannot fill shifts. That's real life. There are children in the hospitals who can't be released because they cannot fill shifts. We must find, train, and incentivize our own staff, and that's what we've done with Joshua. And that's how we've done it, through the CAC waiver, through CDCS, and putting together our own kind of machine. There is no adequate staff in any institution for someone like Joshua. His oximetry alarms will go unanswered. Oxygen cannot be titrated to his needs. He will drown in his secretions because there won't be no one at his bedside to suction him. Josh's heart rates fluctuate between 39 and 160 in one shift. We have to check his blood pressure before any of his meds. He gets meds 3 times a day and as needed, but we have to check his blood pressures because certain types of meds that he gets, if his blood pressure isn't at a certain level, he will crash. This is not a Minnesota Board of Nursing issue. It's outside the scope of what they do. This is a DHS responsibility for the safety of their clients issue. I'm on the CARE Network Caregiver Advisory Board for the National Alliance for Caregiving. I have a Master's of Science degree in Healthcare Administration. I participated in the RAISE Act initial report to Congress in 2021. I was an author for the Blueprint for Change framework of the Maternal and Child Health Bureau for HRSA, writing exclusively on the needs for children and youth with special health care needs. I have published in Pediatrics Journal, Complex Medical Journal, and other medical journals with leading physicians across the country on the unique needs of this population and our families. I am not at all saying that to call attention to myself. I'm saying it because I've done the research on that side, and I've lived it on this side. So I have it from a comprehensive viewpoint. So I've researched it, and I'm living it, and we're seeing that this is working with the waivers. So there's no empirical data to show that risking the lives of individuals like Josh is worth making the process easier, which is what we've been told as to why we're doing all of this. It's not a proven justification for risking their lives. I've been on the Community Advisory Board for all phases of the Home and Community-Based Services evaluation of the assessment process for disparities in the waiver, to access to the waiver and use of the waiver. There's been no indication that the results of that study, which is done by the University of Minnesota, which the results are in direct conflict to many of the outcomes of what are found in the study, have ever been implemented or integrated into the design of the reimagined waiver. A couple of years ago, concerns were voiced about the subjectivity inherent in the Minnesota Choice Assessment tool. That has not been scrutinized, and now with only 2 paths, home with inadequate, unsustainable, or restricted budgets, or congregate care, The stakes are too high to forego any notion of objectivity in this model. My recommendation, support this bill or just halt this. It's not worth losing what we have. It's not worth Josh dying or being put in a facility where he will surely die quickly. I'm sorry that you have to hear that, honey. So support this.
You're good, Debbie.
Thank you.
Thank you. Thank you for your testimony.
Thank you.
Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you so much, Chair Rasmusson. Thank you, Chair Hoffman, and committee members. My name is Maren Christensen Hofer. I'm a parent of a child with a disability, and I also serve as the executive director for the Multicultural Autism Action Network, which is a nonprofit that serves families of children with disabilities in our multicultural communities. And I'm here to express my strong support for Senate File 2215, and I'd like to specifically talk about the sections that require budgets to be based on need and not location of services, and I will try to be very brief. Our organization strongly believes that individuals with disabilities should be assessed for their waiver based on their level of need and not where they're located. To do otherwise is for the state and counties to put a finger on the scale in favor of congregate settings, which is in direct contradiction with Minnesota's least restrictive environment requirements and our Olmsted Plan. And this is particularly important to the communities that we serve, who often prefer to care for their loved one at home when there are very few options for culturally competent care. It also discriminates against people living in some of our rural communities where they may not have many options for congregate care, and as well as discriminating against those for whom that is simply their preference. And just to give you one very specific example, and I'm sharing this with the family's permission, one of the families that we supported had a child whose budget went from $250,000 a year, $250,000 a year, in a residential setting down to $35,000. And there was no change in the child's level of need, no change in the level of services they required. The only difference was that they went from a residential setting to a home setting. We express our strong support also for including people with disabilities in the decision-making roles. And I would just like to add, this is not about inviting people to the table or tolerating their presence. It's about centering the voices of the people who are most impacted. And that should be the rule and not the exception. Again, I want to give my thanks to Senator Hoffman for authoring this bill, and thank you, committee members. We hope that you will support it. Thank you.
Thank you, Ms. Bender. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Okay, thank you, Chair Rasmusson and members of the committee. My name is Jean Bender. In the past few years, our families had many conversations about the future for David, our 38-year-old family member with multiple medical, physical, and intellectual disabilities. He's one of 3 adult children, but he's always needed significantly more support and family resources than his siblings. We've always planned to ensure that David has what he needs so his siblings can accept a guardianship role in their brother's life. But with the current Waiver Reimagine budget plans, that won't happen. Instead of receiving more support dollars when we can't provide the majority of his care, he'll receive significantly fewer because he lives at home. David's dad has terminal cancer. As we redid our wills and David's guardianship documents, David's sister, who is a nurse, is so scared of the future as David's guardian, she made the heartbreaking request to be removed from any future legal responsibility for David. David's brother lives out of state and is terrified of handling everything when I can no longer continue. In David's early 20s, we bought a duplex so he could move to his own home while we lived upstairs and could be actively involved in his transition, provide unpaid caregiving, and ensure that he had the necessary services to transition to independent living with supports. Our son has a CAC waiver, hospital level of care, and uses consumer-directed community supports, with a budget that is at a maximum a quarter of the cost of the 24-hour care he would require in a traditional residential facility. To digress a moment, David only got that waiver after weeks in the hospital and back and forth arguing after we had submitted the necessary medical documentation. I finally had to send the county the statute of what was required for a CAC waiver determination, demonstrating that we'd already met that and forcing compliance. Thus my support for the legislative task force. Sometimes you need the law to force systems to do what's right. I encourage you to read the letter that I enclosed. I'm going to skip a bunch in the matter of time. That's all documented in my letter. I just want to say our parent group's one of the first to forego homes in favor of truly person-centered living. Most of us in this parent group are privileged, middle-class, highly educated, English-speaking, American-born. And if we fail, other families can't or won't even try. They'll focus their efforts on supporting transitions to more expensive provider-owned residences. Here's my ask. Support this bill. Don't let our creativity and sacrifice for our loved ones mean nothing. Thank you.
Thank you for the testimony. Member discussion to the bill. Senator Abler.
Thank you, Mr. Chair, and to these dear people that are here. Senator Hoffman, you and I have had a chance to share chairmanships of this committee in the past. We've been, at some points, two people doing the same thing, indistinguishable in our passion and concern for this group. I don't recall what year it was, but I remember the department really wanted to get going on Reimagine 2, and they assured me it's going to be great. It's going to be, Senator Hoffman, remember that? They pushed us, and I talked to you, and there was some savings to be had or something, and so we negotiated, and on line 1.10 of this bill, we got the word collaboration there, which was kind of hard fought. We just didn't want a consultation, which means take a bunch of Post-it notes and not look. But collaboration means like a partnership. And you collaborate, there's one side, and at the end you come up with a resulting idea. And with that, I felt comfortable agreeing to it. It was my agreement, my decision. And to go with the awards that are there, and they said, oh, wait, it's just a few bugs. And I remember sitting, I don't remember who was at the table, from the department. I'm not here to bash the department, but they're overworked, and some of these things take a life of their own. And I said to them, you got to have a few percent of workarounds, but you can't have half the people on a workaround. That's not a system. You got to fix the workarounds. They have to be consistent. If you're going from an institution at 200,000 to an individual at 35,000, something's wrong with that rubric. And I'm sorry I had to bring the bill forward. And maybe I should have been braver. I should have held out longer. It was getting to be the end. We were. I just remember some of the dynamics going on. You got to get done. You got to get done. And so. But we trusted, I trusted, you trusted, that their word was good, and the people up there in the corner aren't liars. But there's some kind of a unseen bureaucracy somewhere that I don't know where the key is in you. And you're the chair now, maybe you can find the key. And I'm not just putting that off on you, it's just people call you back better than calling me back. You have a governor who swears that he's interested in this. He's the person that could unlock this bureaucracy, if he would. With a phone call. And all he has to do is say, make it work. He's the chief executive of the great state of Minnesota, and he could say, make it work. And maybe to the people concerned about that, you want to get his attention. In terms of statewide desire and policy, we agree on a bipartisan basis, beyond partisan of any nature, that the individuals that we see here, parents and the children and relatives and loved ones and providers, are really important, and that we're willing to spend the money. Heavens forbid, because we agree that these lives are extremely valuable and really important. And in a different time, I might ask them to come down and defend themselves why this is that way, but I don't know if they're even aware of the details of the workings of these families. They're so responsive on things that we fix sometimes, and I just want to give them only credit, because I know their heart. But it's not working. And is this bill going to, now you have another group to talk about it and see how it's going to go? I think at some point, Mr. Chair, is there a way just to pause the whole thing and say, let's just wait till we get it right? We saw the role of CFSS, and it's coming, but even after 12 years, it was hard to get that off the ground. But listening to testimony today, I don't know how responsibly we can say, yeah, just move right along. And so that's a discussion for the committee. I don't even know the mechanics of it. But I can tell you, Mr. Chair, it was the word collaboration that I argued a couple of days about, trying to get a word that was strong enough to make them actually work with the departed now Commissioner Harpstead, and she agreed.
Yeah.
And I don't know, I'm just flustered and flummoxed and sad, and I grieve for the lives of the people who we're to care for. Mm-hmm. And I can only do the best I can do, and at that point, I'm sorry my best wasn't good enough. But, Mr. Chair, it's today, and so where do we go?
Yep.
And so this is something going to provoke a discussion. But I think that, I mean, this is not a political statement, but our governor is the head of the National Democratic Governors Association.
Yep.
And so we could be constructive in his voice at the Minnesota level, but also in talking to Washington as National Democratic governors, not just to throw stones and, oh, what is all this? There's a trifecta there, which people may not like. But there was one here which I didn't always like. And so how do you find a way to be in a constructive voice and say, above all, members of Congress, when you make your changes to Medicaid, make sure you don't hurt these folks in a constructive way. Yeah. We're short $36 trillion, Mr. Chair, which I think is a lot of money. But that's my encouragement, and I don't know where to go. I'll just quit talking. But here we are again, Mr. Chair. Thank you.
Senator Hoffman.
Mr. Chair, to the Senator Abler's point, I remember you had made comment about what are those 3 C's that we should be doing in public, the public policy stuff, and that's where the word collaboration, because it was comprehensive, coordinated, and collaborative, right? Do you remember that? And that I absolutely remember that fight, and I remember, oh yeah, this is going to be the best thing. Waiver Reimagine, we're working with our consultants, and we're going to do this. And yet at the same time, you heard from Kathy Jo Ware. Jim, she was telling us years ago, this is how it should lay out. Debbie's been saying this is how it should lay out. And the department didn't listen to them then, and they're not listening to them now. So I'm bringing this bill saying this is going to happen. And I'm not pointing fingers to the people in this room that we know, right? But somebody, Jim, when you were the chair, absolutely was telling you the same bunch of stuff they're telling me. And yet, now this committee is going to have to look at, we're going to have a conversation on cutting services, and this is the reason why we exist. And it just breaks my heart as much as it breaks yours. So thank you for bringing that up. And I was told, and he's a state rep from the other body, was in the same room as me from Minneapolis, Representative Neuer, was there when the then commissioner said, we can put a pause on this, we can go back, because she even said it's not making sense, right? And he'll back me up on that. Well, she's not here anymore to admit that, right? But the point is, to your point, I agree with you. I think if there's a way we could pause this to get this group in, without families, I mean, you got to have that viewpoint on that table, right? That's making decisions. You've always said that. And so thank you. And I'm sorry I'm showing a little emotion here, but I happen to know Debbie was on the PACER board 30 years ago when I was just a young kid running around. I'm still a young kid, Glenn. But I mean, I've known everybody that came up here, I've seen their children live to be adults now, and we do what's right. So I just need to say, if there's a way we could pause this, Mr. Chair, absolutely. Maybe we could request from the department the conversation that the former commissioner had with us. There's got to be a way to put the pause on this, right? And if you really truly believe in one Minnesota, that means you don't leave people with disabilities on the side of the street. And unfortunately, when you say you're going to take 65% because you're the growth in Caddy, the growth in this, let's have a concerted conversation about what that truly means. Don't just throw a bunch of numbers out there. And I'm sorry, if I'm coming across as pithy, I'm a little angry too, Senator Abler. And so that's really sad. But the reality is we sat here 2 years ago, and even before that, we always talked about why we do what we do. This is why we do what we do, right? So I appreciate you and appreciate the work that we're doing.
Thank you, Senator Hoffman. Senator Gruenhagen.
Well, thank you, Mr. Chair. Yeah, thanks for bringing this bill forward. I'm kind of new to this particular area, but I would like to see somebody from the department come down, not to be accused, but I do have some questions for him. If there'd be somebody up there that would come down?
Senator Gruenhagen, we also have 3 other bills on, but I would encourage the department or any member of this committee to make sure that they can follow up with the DHS staff to get information, and perhaps at a later date, it'll make sense for them to come and give an update, if that sounds good with you, Senator Hoffman.
Oh, absolutely, Mr. Chair. I think to that point, we should have, the new commissioner or who are those people, because if he's going to get in the weeds, like I know he probably will, we want to make sure we have the right person in here. Just like when we were asking Ms. Bailey the questions that we had, she's got to go back and get information, which is fair. That's how it is. So I agree with you, Mr. Chair.
And Senator Hoffman, I know that your motion here shortly is going to be to send this to state and local government, but I assume that this would be potentially considered as a part of a human service omnibus bill, Senator Hoffman?
That is my intention here as well. David's shaking his head yes. Senator Abler, is that?
I
got a question.
We'll have another chance. Senator Grunehagen.
Oh, thank you, Mr. Chair. Yeah, I guess I'll state my questions that I'd have for him.
Yeah.
Number one, what does it take to pause it and stop the bleeding or the misery?
Yeah.
Number two, I'd like an answer to why would the department take a perspective of trying to take people out of their homes and based on the testimony and put them into a residential or a much more expensive residential building or community? Why would they do that?
Yeah.
That's what I really want to ask them. And so what does it take to pause it? And why are you doing this? When the costs are exponentially higher, the care is not as good, and they've got people that really care about them.
Thank you.
So anyway, if we can get answers to that, I'd appreciate it.
Thank you, Senator Grunehagen. Senator Hoffman moves that Senate File 2215 as amended be recommended to pass and be re-referred to the State and Local Government Committee. All those in favor, please say aye.
Aye.
All those opposed, please say no. The motion prevails.
Mr. Chair and members,
Thank you,
thank
Senator
you.
Hoffman.
I so appreciate you guys. Thank you, Greg. Bye.
And Senator Hoffman, the next bill we have is Senate File 2347. I don't have any amendments here on this bill, Senator Hoffman, so if you could please describe your bill, or we can also move to testifiers, whatever you prefer.
Yep, thank you, Mr. Chair and members. Let's just, in the interest of time, I'm going to go ahead. It's a simple appropriation for a recovery community organization that we have. I got Abdi Rahim Swasami, who's the co-founder and executive director. I'll let him go through that since we don't have any amendments and we have an interest of time. Let's just have the conversation.
Thank you. Mr. Warsami, welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Hi, guys. My name is Abdirahman Warsami. I'm the co-founder and executive director of an organization called Generation Hope. We're a recovery community organization based in the Twin Cities, providing recovery support services to individuals struggling with addiction or have struggled with addiction, people that are in recovery all throughout the state. We also provide culturally specific recovery support services. Starting in 2019, I'm a person also in long-term recovery, starting this organization with my friends 3 months into my own recovery journey due to the fact that a lot of people in my community were dying from substance use disorder. Stigma is so huge in my community. If somebody dies from addiction, a parent will tell the community that this person died from opioids, or that they died in their sleep. And so we started doing this work in 2019, and over time we've grown, and we are looking for to receive support from the state in order to further reach our community. There's a lot of people in our community that are dying, and a lot of times people do not bat an eye to what's going on. And I got 2 guys from our organization who provide support in our community, and they're going to just quickly tell their story.
Thank you. Mr. Mohammed, welcome to the committee, and please introduce yourself for the record.
Yeah, go ahead. Go ahead.
Hi, my name is Shamarki Abdi. I've been in the recovery journey. I've been on my recovery journey since 2021, and I have been abstinent of substances since September 16th of 2023. I've been struggling with addiction since 2018, and I came across Generation Hope in late 2019 when they were hosting events in Bryan Coyle, raising awarenesses around drug addiction. Generation Hope have saved my life. If it wasn't for them, I don't know where I would be. They were the people that I would have called when I didn't know where to get support during COVID-19, when I didn't have nowhere to go. I first found out what treatment really was. It was with them, and they were the people I talked to when my friends were dying, especially. And honestly, there was nobody I knew that was sober except for them, not only because they were from my community, but because there was no one else that I could relate to. Because of them, I am now a certified peer recovery specialist hired by them. The same organization that helped me, and now I work with over 20 individuals from our community, helping them to get sober and stay sober. There isn't many people that do what we do, so please support this bill to help us continue saving lives. Thank you.
Thank you.
Hi,
Please introduce yourself, welcome to the committee, and proceed with your testimony.
Hi, my name is Ridwan, and I've been sober for 2.5 years right now, and Generation Hope has helped me with that journey. And I would say this program will help people mainly by being out there for them. And I would say, from my point of view, my family could not help me because I was really not, at that point in my life, mad at them, and I didn't want to talk to them. And somebody that was out there that I did not know did a lot for me, and I would say the program would do that for a lot of people out there right now that feel just like that, and they don't want to be around their family or people they know, and somebody that's a CPRS or like that gets that knows a little bit about recovery will help them a lot. And I'll say, yeah, please work on that, and yeah, thank you.
Thank you. Member question, discussion. Senator Utke.
Thank you, Mr. Chair. I'd like to start out with a few questions just about the organization itself. And the first one, Mr. Warsami?
Yes.
Okay. I think you said this was started in 2019. Was that correct?
Yeah, as a
Mr.
grassroots
Warsami.
organization. So I'm only 27 years old, Senator, and so when I started this organization, I was 3 months into my recovery, and I didn't even know what a nonprofit organization was. There was a lot of people in my community, close friends of mine that I used to use with that were struggling from addiction and dying, and we really didn't have nowhere to turn. When I got clean, I didn't know what treatment was. I didn't even go to treatment. I stayed with my grandma in Harlem on the corner of 103rd Street, 104th Street and 3rd. Right by Central Park. And I stayed in my grandma's apartment, 2-bedroom apartment, and struggled with the withdrawals for about 2 months, not taking Suboxone, not taking methadone because I didn't know what it was. And that's a story for a lot of people from my community because of the lack of disproportionate resources that's provided to people from my community. A lot of people don't know what substances specifically are, specifically because a lot of people that are immigrants, have come here only 20 years ago, don't know what opioids are, don't know what fentanyl is. A lot of times parents whose sons or daughters have struggled from addiction and die from addiction find their kids in their houses, dead in their house, and don't even know what happened to them. They end up calling the police and can't believe that their kids died from drugs because they didn't have a clue. So we started our organization in 2019 just trying to provide awareness by hosting events, reaching out to people in our community, going around in the streets and just talking to different people that we used to use with or people that we knew that were struggling with addiction. And from there, it just kind of took on fire. Parents would call us. We would go and do host family interviews or talking to families. And then that's where we kind of switched over into getting into peer-to-peer based support, doing recovery coaching, working with individuals, not only before treatment, but after treatment to help people stay sober because there isn't anybody in our community that does that.
Senator Utke.
Thank you, Mr. Chair. And I'm just, again, trying to learn, about the organization, and so I wanted to confirm the start date. But because typically when we're offering these grants, I like to look at what the history looks like, that you can see that's in public information. In 2023, it showed that you had taken in under $170,000 total revenue, and in this case, it's looking for $1 million grant. Can you explain that? Are the numbers that we're seeing online correct? It, of course, doesn't show us yet 2024, but what have you done between there? And I guess the thing that comes to mind of that, less than 170,000 that you took in, where do you get your funds currently before you come into the state now?
Mr. Warsami.
Oh,
Mr.
you were
Warsami.
just saying my
Sorry.
name.
Yes, yeah.
I'm sorry, I'm confused a little bit with
No,
the. Okay.
wait to be
Processes,
recognized by
right?
the chair, and then you can proceed. Mr.
So,
Warsami.
yeah, so in 2023, we were, just as I said before, we were a grassroots organization when we started. Really weren't getting a lot of funding, and in 2023, we received funding from the city of Minneapolis. But we pretty much, a lot of the programs, receivables that we get right now in 2024 comes from we're a recovery community organization. So a lot of the programs that we provide now is fee for service. And so that allows us to have generate a higher amount of revenue that allows us to be stable. But beforehand, we were really solely relying on grants. And so we didn't have the capacity to support our community in the way that we wanted to. And that's why we got into providing this, program to further benefit our community and further be stable as an organization. But you only can provide so much support to your community. Even in that, there's only certain things that you can bill for, certain things that you're allowed to do. So, for example, we have peers that work with individuals in our community, but there is an entire process that they have to go through before they're even eligible to receive our services. Before then, we still have to talk to sometimes families, for hours, go to community members to talk to their kids. They'll call us and we have to go talk to their family. During that time period, convincing the individual of the program or telling them what the program is, telling them about the services that are available to them. All of this is, program services that we don't get paid for, so that's the whole idea of it. But in terms of supporting ourselves in receiving this funding, we have many support in our community. We work with organizations such as Propel. We also have line of credit. And so there's other things that we can do and utilize in order to, so to say, if we were to get funding, be stable with the funding.
Senator Recchi.
Thank you, Mr. Chair. I just got one last question, and that is going from the money that we see from 2023 to $1 million. It's a huge step up. What do you visualize? What additional services, or what would you do in addition to what you're currently doing with that much more money?
Mr. Warsami.
So the whole program, sorry, when he says Mr. Warsami, kind of throws me off for a second. But the whole idea of the program is to do outreach and to educate our community, and also to further get more peer recovery specialists from our community. Currently we only have about 4. Even though there's hundreds of individuals in our community that struggled with addiction or that are in recovery, and a lot of times it's because for example, us ourselves, we aren't peer recovery support specialist trainer. We don't have the certification in order to do that. We don't have the capacity to provide the training. We want to be able to provide the training to our community. We also want to be able to reach our community without putting a financial strain on ourselves. So, from doing outreach, there's a huge number of individuals in our community that are experiencing homelessness, that are struggling in all shapes and forms, and we want to be able to reach these individuals so that we can better serve them. And so having this funding will only further not only stabilize us as an organization to do our job better than we currently do, but we would be able to reach so much more people, not only in Minneapolis, but through regional diversity. There's individuals, in our community that are struggling in St. Cloud, in Rochester, in, places like Moorhead. All around, there are different individuals that struggle with addiction from our community, but they don't have a community organization to serve them.
Thank you. And with that, Senator Hoffman, any closing remarks?
No, just Mr. Chair and members, thank you. This is a deep, unseated need that's out here, right, in the recovery world, and specifically within this population that Mr. Warsami is talking about. There's a lot of shame based in that too, right? It's harm to even be alcoholic. Then you hide it, and then it's double hit. And so it's again one of those, we're finding little hidden things like we do in your backyard that makes right. And so with that, I know we don't have any money. But I wanted to show the need to you, Mr. Chair, and to members. This is still an unmet need that we need to address, and so I appreciate that.
Thank you, Senator Hoffman. With that, Senate File 2347 is laid over for possible inclusion in the omnibus bill.
All right.
Up next, we have Senator Maye Quade with Senate File 2383. And if we could have the testifiers make their way down to the table for that bill, that would be appreciated. Looks like we also have one joining via Zoom. Senator Maye Quade.
Thank you, Mr. Chair.
And I have it here that you have an author's amendment.
I do. I have the A1. I'll move that.
Senator Maye Quade moves the A1 amendment as an author's amendment. All those in favor say aye.
Aye.
All those opposed say no. The motion prevails and the A1 is adopted. Senator Maye Quade, to your bill.
Thank you, Mr. Chair. With the A1 amendment, the bill before us today, Senate File 2383, appropriates $5.5 million in each year of the biennium to the Senior Nutrition Program and $2 million each year to provide support services, including assisted transportation, homemaker services, and outdoor chores. Programs providing meals for older and aging adults are grossly underfunded and not meeting the needs of today's population. Demands for meals continues to grow as our senior population increases. In the last biennium, I also carried the Senior Nutrition Program appropriation, which was the first time in 20 years that the program received increased funding. This year's bill demonstrates our continued commitment to senior nutrition. Lack of nutrition puts already vulnerable people at higher risk for illness, longer hospital stays, and higher levels of readmission. Malnutrition is complex and driven by multiple factors, and lack of access to nutritious meals is a key component. Meal programs are an essential part of sustaining the well-being of older and aging adults in Minnesota and contributes greatly to a thriving community. So I hope that we can support Senate File 2383, and I will turn it over to my testifiers.
Thank you. I have Ms. Simonson. Please introduce yourself for the record and proceed with your testimony.
Thank you, Senator Maye Quade, and good afternoon, Chair Rasmusson and members of the committee. My name is Dawn Simonson, President and CEO of Trellis, and a co-chair of the Senior Meals and Services Coalition. Together, we support seniors trying their very best to live at home with chronic conditions such as arthritis and heart disease or following a stroke. Many do not drive, live alone, have difficulty shopping or preparing healthy food, and need help with laundry or cleaning. We catch these seniors upstream before they spend down to federal, state Medicaid-supported long-term care. And every service we deliver has the added value of reducing isolation. In the bill before you, our coalition asks your consideration to renew the $11 million biennial appropriation for meals and to fund at $4 million the supportive services of assisted transportation, homemaker, and chore. The Minnesota Board on Aging voted affirmatively at its February 21st meeting in support of this request. Please consider the following. First, and as expected, Minnesota's older population has ballooned, outpacing youth, and stands now at over 1 million seniors, with nearly 10% living in poverty. Second, the demand for services has outstripped resources and providers have few choices. In the metro and elsewhere, providers are reducing the number of meals by at least 487,000 in 2025 and putting new clients on wait lists. In central Minnesota, providers are closing dining sites and eliminating meal routes. Assisted transportation and homemaker services are limited in most communities or are non-existent. Third, it's well understood that meals, rides, and in-home help are the core services that people need to age in place, and they are generally much less expensive than assisted living or nursing home care. Investing in these critical services must be a part of Minnesota's strategy to care for older adults. Thank you for hearing our bill and for considering the needs of seniors. They have contributed to our communities over their lifetimes.
Thank you for your testimony. Welcome to the committee. Please introduce yourself and proceed with your testimony.
Thank you. Thanks very much for letting me come talk with you in support of Senate File 2383. My name is Leah Hebert-Wells, and I'm the CEO at Open Arms of Minnesota. For almost 40 years, Open Arms has been preparing and delivering medically tailored meals to vulnerable, sick, and food-insecure Minnesotans. We prepare over 1 million meals per year in our metro area kitchens. And we deliver and ship those meals to thousands of Minnesotans, not only in the metro area, but also in rural counties, who are living with life-threatening illnesses like cancer, heart disease, and more. We provide our clients with meals that are tailored specifically for their illness. So for instance, a low-salt DASH diet for our clients with cardiac issues or a dialysis-friendly diet for our clients with kidney failure. 80% of our clients are living with food insecurity as well as a critical illness. All of them depend on Open Arms because they are too sick to shop or cook for themselves. 1/3 of our clients come on service at risk for malnutrition, and over 77% of them improve or stabilize while on service. In 2024, state senior nutrition funds and other federal dollars helped Open Arms provide 316,000 meals to 1,623 clients over 60 years old. But as you have heard, current funding is not enough to serve all seniors in need. This week, Open Arms is providing meals to over 600 senior clients, but we have another 100 on our waiting list, and we turn away another 150 clients per month. These are food insecure, low income, often homebound, and malnourished older Minnesotans. One of our clients, Julie, 67 years old, came on service after learning she had both cancer and congestive heart failure. With her health conditions and limited mobility, receiving meals from Open Arms has made it possible to manage her congestive heart failure. Her husband, Doug, has blood cancer, and getting weekly meal deliveries has allowed the couple to spend more time focused on their recovery and treatments. Another client, Gary, heavily relies on Open Arms meals because the VA Home Care just recently stopped offering grocery shopping services for clients, and Gary has very limited mobility. Investing in senior nutrition helps reduce hospital visits and nursing home admissions, and it saves the state money. Senior nutrition reduces malnourishment and can make the difference between living independently or needing more expensive institutional care that the state often has to pay for. It's not overstating to tell you that senior nutrition saves lives. I hear it from clients every day. So please help us save more lives with this funding, and thank you all for your time.
We also have a testifier joining us via Zoom, so we'll now go to Jeff Waite. If you could introduce yourself and proceed with your testimony.
Yes, thank you, Mr. Chair and members of the committee. My name is Jeff Wyant. I'm the Senior Services Director here for SEMCAC. We're a Title III service provider in Southeast Minnesota with the mission of promoting the independence, dignity, good health, and well-being of older adults. Nutrition is a critical social determinant for older adults in Minnesota, and the service that we provide delivers a hot, nutritious meal to the homes of older adults or allows them to enjoy a hot meal and socialization at one of our dining sites. SEMCAC also provides transportation services through our assisted transportation program and support for older adults and their caregivers through our Caregiver Access and Information program. The daily check-in from a volunteer, the socialization at a dining site, and the nutritious meals that are provided, paired with the additional supports of transportation and caregivers, allow our older adults to remain independent in their homes and active in their communities. Currently, we serve approximately 45 locations, with the majority of them being small, rural, and hard-to-reach communities. These communities are limited in the food resources they have, typically only having a small C-store or a small diner. The older adults that live in these rural communities deserve to have access to the same meals and services that are provided to all older adults across Minnesota. However, if reduction in services are needed, these remote communities will be the first to lose out on these critical services. Over the last 6 years that I have been in my position, the positive comments and testimonials have totaled in the thousands. However, there's one quote that always sticks with me showing how critical these services are. It's from a rural client in Maye County, and he stated, "These meals have been a blessing, but some days it's too hard to cook for just one person. And without these meals, some days I would just go without." Finally, our older adults are also key economic contributors to Minnesota. Older adults pay taxes, they volunteer, and they support our local businesses. Investments in these home-based community services will allow older adults to stay independent in their homes and vibrant parts of their communities while delaying the need for assisted living and nursing home facilities. Thank you for hearing and considering our bill so that we can continue to ensure the needs of our older adults are being met. Thank you for your time.
Any member discussion to the bill? Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, thanks for the testimony. Say, just for the record, DHS did want to come up and defend itself, okay? I went and talked to those ladies. So maybe sometime in the future, we could have them up to give a different perspective on this Imagine thing, whatever that. And they do admit there's problems, okay? It's just by the time the testimonies were done, it got a little, but anyway. I always like to hear two sides of a story. Anyway, yeah, my question is, so how long has this program been going on?
Ms. Simonson.
Chair Rasmusson and Senator Gruenhagen, the Federal Older Americans Act was established in 1965, and I believe area agencies on aging, like my organization, it was 1973. So I think that the programs began shortly after that.
Okay.
Senator Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, thanks for that. And then how many people did you serve in 2024?
Ms. Simonson.
Chair and Senator Gruenhagen, I have some information with me. This is a number from the Minnesota Board on Aging. So statewide, In 2024, their data indicate that senior nutrition programs served 41,784 people.
And was your budget $11 million at the time?
No, the budget is greater than that. There are federal funds and some base state funds.
Okay.
Senator Grunegan, any follow-up?
Yeah, just, so there's additional funds above the 11 million that you'd receive from
Ms.
the federal
Simonson?
government?
Chair and Senator, that's correct.
Okay.
Senator Grunegan, any follow-up?
I'll pass for right now.
Okay. I don't see any further member discussion. Senator Maye Quade, any closing comments?
No, Mr. Chair, thank you so much to all the members, and this is just really important. If people can't eat, they can't stay in their homes.
Senate File 2383 is laid over for possible inclusion in the omnibus bill. Thank you, Senator Maye Quade.
Next up, Senator Rasmusson, Senate File 2310. Thank you, Don. Good to see you. Thank you for traveling all the way in from the great city where you and I live. And as I was coming in from the back room, I noticed that Mr. Freeman has joined our committee too, so welcome. Senate File 2310, Rasmusson. You know, I was just biding time. It's an old radio gig. Supported decision-making programs, grant availability for supported decision-making programs extension. Senator Rasmusson.
Thank you, Senator Hoffman. As some of the committee members may remember, back in 2023, we had the opportunity to utilize some one-time funding to create some grants for supported decision-making programs across the state. And we had a lot of really great testimony and support for that program that made a one-time appropriation of $4.55 million to DHS to put out these awards. And just to make a quick summary of what supported decision-making is that it's to help ensure that individuals who would otherwise end up in guardianship or conservatorship make sure that they are able to live the most independent lives possible. And there's been some really great success stories that have come out from this work. However, one of the challenges is just given a delay in the RFP process and being able to get those grants awarded. Today, we're asking with this bill, not for a new appropriation, but to simply extend the timing for when these dollars can be spent. And the main thing here is we just want to make sure that this money is spent wisely and that the providers who have been awarded these grants are able to effectively implement the programming that they have lined up for this funding here in 2023. And so with that, Mr. Chair, I'd be happy to go to my testifiers.
Thank you, Senator Rasmusson. Megan Thomas, you first. You going to do it?
Yep.
All the way from Rice County. Welcome.
Thank you. Thank you, Mr. Chair and members of the committee. My name is Megan Thomas. I'm the Adult Services Manager at Rice County Community Services. I've been at Rice County for more than 8 years in adult services, currently serving as the manager there. Prior to that, I was in the private sector overseeing community residential services or group homes for people with disabilities for more than 20 years. I'm testifying today in support of Senate File 2310 because I believe we need to continue to invest in supported decision-making as an alternative to guardianship in Minnesota. I have lived in Faribault all of my life. I have seen that guardianship and conservatorship became the norm and the need for those who are considered incapacitated. People with disabilities and other cognitive impairments are not a rubber stamp for guardianship. We need to do better in Minnesota, recognizing the rights and responsibilities that people have when it comes to making their own decisions and being able to live out their life the way that they choose. Now, don't get me wrong. I have worked with some of our most vulnerable people. I believe that there are a number of people who need protection from guardianship that can be provided. However, what I do not believe in is that we just make assumptions based on biases and opinions. Because of the supported decision-making grant that was passed in 2023, Rice County was able to implement education and training as it pertains to SDM, as well as employ social workers who directly serve as SDM for individuals. It has allowed us to serve people in a respectful way, no court orders, no forcing decisions on a person, no attorneys, no judges. all of which are very intimidating and can create anger and animosity against people who are just trying to help. Not only that, but SDM is a cost savings mechanism. In just the last 3 years, Rice County alone has incurred more than $2.6 million by paying attorneys, agencies, and staff for costs associated with guardianship. The more we can divert people out of the system, the more we can save our taxpayers. The state-funded supported decision-making program gives Rice County the continued opportunity to serve more people with supports and navigation in this complex system, as has already led to some amazing stories. Since we started using the funding just less than 6 months ago, we have received 35 referrals, we have diverted 3 cases from unnecessary guardianships, and we have already suspended 1 guardianship so that SDM can step in and show its success. In another instance, we have served a man who's gone from being homeless for 5 years, was able to move to an assisted living, get his medical needs met, while SDM worked with him on coordinating medical, county, and housing supports. With a longer runway to use these grant funds, Rice County will be able to support more people with SDM, to build skills and provide for resources and ways a person can learn how to navigate a service and support, all while making their own decisions. Thank you for your my opportunity to testify in front of you today, and I ask you to support this bill.
Thank you, Ms. Thomas. Wonderful, wonderful, wonderful. I sat here and I said that many and little, and then Nate was shaking his head. I said, Rice County? And I was shaking his head. So Nate Danielson, welcome back, Lutheran Social Services.
Thank
It's
you.
not just for Lutherans anymore.
Yeah, right. Yeah. Thank you. My name is Nate Danielson. I'm the Senior Director of Supported Decision-Making, Guardianship Options, and Trust Services at LSS in Minnesota. LSS provides guardianship services to 1,500 individuals across all 87 Minnesota counties and even North Dakota. We offer high-quality, person-centered guardianship, and we have long recognized the need for stronger alternatives to guardianship. This grant has given us the opportunity to explore these alternative approaches with the goal of preventing and reducing the use of guardianship. One of the programs funded by this grant allows us to restore the rights to individuals currently under guardianship with the goal to move towards limited guardianship by restoring some rights or achieving full restoration by removing guardianship entirely. One notable success story involves a 61-year-old male under guardianship through LSS. He lives independently, owns his own car, has a job. He's been considering petitioning for full restoration for a long time, but was just unsure of the process and needed support. LSS supported decision-making staff member worked with him to complete a supported decision-making agreement, documenting his already existing network of supports, then helped him file the petition and submit it into the court. He submitted his paperwork and is waiting on his hearing right now, probably in the next few days. So it's really exciting. But to date, we've already reviewed 170 guardianship cases. Of these, we've met with 50 different individuals across the state, and we've achieved full restoration of 7 of them. So another great success story is a program that involved a 60-year-old woman who'd experienced a mental health crisis after her husband died. After being stabilized in the hospital, she discovered she had been evicted and was stuck in the hospital. LSS became her healthcare agent, so an alternative to guardianship, with her consent, and within 1 month, we were able to meet with her, secure benefits, find stable housing, and transition her out of the hospital, all while preserving her rights and avoiding guardianship entirely. Through our supported decision-making work in the hospitals, we worked with 25 individuals in that short time to avoid guardianship entirely. Currently, we have SDM staff in Moorhead, Duluth, Twin Cities, Mankato region, working with individuals aged from 16 to 85 years old to restore rights and prevent or reduce guardianship. Although this work is in its early stages, we believe supported decision-making not only preserves the dignity and the rights of the individuals, but is also cost-effective. A study from New York has shown that every dollar spent results in $2.75 in savings to the human service system at large. We believe extending this timeline of the grant will yield similar results in Minnesota.
Thank you. Thank you, Mr. Danielson. And you, Lutheran Social Services in Champlin, there's the success story is one of the homes that you have in Champlin. I just want to say, being there and touring that, and I know the work that you do, so this doesn't surprise me. Senator Rasmusson, $800,000, I think, might be left over on that. Is that all, you looking for all that to be forwarded, or is there any that we could use to help offset, some other, I'm kidding. I mean, it's just like.
Thank you, Mr. Chair. The intention, if you look here in the bill.
He would have asked the same thing, because he's smiling down there, so yeah, no, talk to us.
Thank you, Mr. Chair. No, we have a blank appropriation here, and so would look to work with the Department of Human Services to make sure that as a part of an omnibus bill, we have the correct number in there that we basically need to cancel from the current fiscal year to then reappropriate into the next fiscal year. That would effectively give a one-year extension on this bill. But I do want to say the coalition of advocates behind this bill would love to have come before this committee and ask for additional one-time dollars to proceed with expanding and continuing a lot of the work that's been successful here. But I just want to note that here they're simply asking to extend and best utilize the appropriation that they were given in 2023. And so I think this is the easiest bill to say yes to that we've heard here today, because it won't have any cost against this target.
Senator Maye Quade, maybe Senator Rasmusson should talk to you about if they're looking for more funding to because it's a great program. I'm so glad when you brought this forward, and the more you talk about it, the more you hear about it. And yes, Nate, I was looking at you going, Rice County? Wow. I mean, there's some wow factors. So thank you, Senator Rasmusson. Anybody? You going to talk to Aaron Maye Quade about how you can help find some other funds? Senator Maye Quade.
Mr. Chair, Senator Rasmusson has already given me ideas.
No way. I love it. With that, you want to lay this over into the finance, into our budget bill? Senator Rasmusson, all right, Senate File 2310 will be laid over for possible. Thank you, too, for the work you're doing, and thank you for being here. Members, Monday, we have the DHS policy bills that our conversation was, and I don't see any surprises in them. You guys make sure you're reading those to make sure that there are any surprises from what we were talking about, which then also OIG. There's a Dolly Department of Labor and Industry bill that Senator Utke, unfortunately, when we were told, oh, we're not going to touch that this year, somebody lied to me. I want to find out who that was, Senator Utke, and I would hope that there's a short discussion from this committee, actually not a discussion, because we've had this discussion in the past. As far as I'm concerned, that conversation is over until you bring me a plan. So, Senator Utke, I would assume that somebody in this committee is going to come up with some amendment to do what we need to do. Not that I'm looking at you, but with that, when Senator Utke's done talking, then we'll be adjourned.
I was just going to say thank you, Mr. Chair. I'll make sure that happens.
Yeah, I appreciate that. Thank you, everybody. We are adjourned.